So I'm going to hide the faces just so I can see what I'm doing here. But if at any time anybody has any questions, feel free. We're going to be talking about the collaborative team models that can exist in schools. The first things we were going to talk about is the different types of school teams and services that we have. And this usually builds off the needs of a student. So we have to consider IEPs, 504s, any sort of behavior plans, either a lower grade behavior support plan or a behavior intervention plan, any accommodations or modifications a student might need to be successful. And then beyond having those recommended, we then have to start building a team with the necessary services that go along with it. So we have occupational therapists, physical therapists, speech, reading, math, pullouts, extra support. And then beyond that, a student might have a visual or hearing or physical support, a medical support that typically comes in, from what I've seen most in New York anyway, we have consultants that come into our district rather than working within the school district. You have your mental health team, social workers, psychologists, guidance counselors, behavior specialists. All of these people typically have some sort of overlooking case manager, which we'll talk about a little further as we go. And then the other things that we have to consider when we're building these teams in order to make a collaborative model is who's there and when. So sometimes they're only there full time and sometimes they're there as part-time. Again, the visual and physical medical services tend to be in a consult model. This also depends on certain school districts. Your behavior specialist, OTPT, or any sort of additional services might also be provided on a part-time or consult model basis. And as always, we have our administration as part of that team. There are different schools of thought then with all of those different types of service providers. You have to consider their areas of expertise, the different perspectives that come with each of those areas of expertise, and then the terminology that is paired with that perspective within the area of expertise. They're going to bring different examples. And when we start talking about how to brainstorm together and make our models work within a school district, those different examples are amazing. And that's what helps us really be our most impactful for students to help them reach their goals. Now, this is where it can get a little tough because we get different recommendations based on the professional background of a person, their professional history, and the circumstances surrounding each student's case. And this is where a lot of collaboration falls apart. Because recognizing that we all have different recommendations, but how do we blend them together successfully to make them work? You can see that this is a lot of moving parts. We tend to see a lot of hiccups and frustration, resentment, invalidations, etc., when we are bringing together so many different models from professional backgrounds that don't naturalistically blend. And the nature of a school is bringing all these brilliant minds and thoughts together, but they're not always naturalistically cohesive. And that goes with building any sort of team. But when you get it right and you continue to work on it, you will be really surprised at the genuine and forward-thinking approach that you have for each of your individual student cases. There are some pitfalls and we want to avoid them. I'm going to talk to a couple because I find that these are the most common I've seen over the years. I see a lot of pedantic use of technical language. And that's hard because you also want to kind of sound like you know what you're talking about at a meeting, especially when you're at this big table and there's lots of people there and each person is wearing their service provider hat and bringing all of their knowledge to the table. It's a delicate balance of using that technical language in an effective way without it coming off where you're using this language in a way that is not going to be understood. So we don't want to be a little too over the top. We want to communicate effectively. We want to speak to the team you have. I think it's difficult too when you consider parents parents at that table typically, or a wide variety of groups of people. If you are going to use any sort of technical language, it helps to give some examples paired with it. I found that to be very effective, either listening to others share their ideas or explain something. It's good to not just drop technical language without a follow through of specific examples. And if you were to explain something, even if you were using technical language, it's great to have other people give you feedback in that they are going to repeat back what you just said to them in their own words. And this is a really interesting technique that can help catch any form of misunderstanding, because if they're going to repeat it back to you, typically they're going to repeat it back to you in common vernacular. And if they are able to do that effectively, then you know that you've explained yourself effectively to that team member or to other team members. Because we don't want the point to go over everybody's head. You want your ideas to be shared in a very effective way that's received by others. Something that also comes up is that sometimes in the chaos of a school year, you might forget to invite somebody on an email or to a specific meeting. And this little bit goes a long way in making your team feel cohesive, that it's always a cohesive team. And there are ebb and flows of mood for every individual every day, and that applies to any person in a school district. So if they see, oh, I ran into so-and-so and I wanted to catch you up on that meeting. Did you have something else going on? I didn't see you there. And it can snowball. Even if you might not think it pertains to them, it's best to offer and at least invite them to the meeting. The parents are part of that school team. So some students have team meetings already on their IEP or 504. It's also great if every once in a while a parent is just invited in to speak to the teacher or one of the mental health team members or whomever it is that you assign as your case manager for the case. It keeps them partly cohesive with the whole team. But again, it's another outside perspective that might help us best serve our students. I think this is the hardest bit. I know it's hard for me personally sometimes, is to be open to critique and feedback. Sometimes you might hear something, you're like, well, I don't do that, or you get a little defensive, or you might not understand their perspective, but it's important that that's something that everyone perpetually works on in order to better themselves, but also better themselves as a team participant. There is always going to be situations where you have to agree to disagree. This is going to happen constantly, and we're going to get into how to balance this extensively later on. But this is one of the biggest hindrances that causes a lot of friction of those gears. So for those listening, before I go into how to schedule for success, I wanted to give you your first secret code word, which is avocado. The first word is avocado. I'm going to pause here for a second. If anybody wanted to ask any questions or share any experiences regarding either working in a school district or if they're identifying with any of the kind of hiccups we've seen so far, because I think it's interesting to hear other perspectives, especially since I've worked in both private and public schools. So Ray, let me know if anybody is leaving any questions or comments so far.
So one question is how to invite outside staff. So if parents are working with people in a home-based program, do you ask parents, hey, let us know if you're working with people, or is it the parent's responsibility to actually make you aware that they're working with people outside of the school?
So I think if I could do one of those when you assume connections, is that if we assume that the parent will let us know what's going on in the home to be a constant, we would not get the information that we would need to make a cohesive team. And as we move forward in the presentation, I do talk about those outside providers. So if you're working a schedule in the afternoon outside of school or on the weekends, it's very often that school staff don't necessarily get to speak directly with you. Every single district is different. Some districts have consent to speak forms for those who are working with a child privately. Some schools are contracted with agencies, and if you are contracted through the district in an agency that's within that contract, we do have consent already to speak. And then there's also any sort of outside provider that would be like an ophthalmologist or anything outside of the school district that's still part of that child's team. We would need consent to speak with them. All of those things we would ask the parent for. So typically, if I have a new student assigned to me as a mandated student, or if we find that a child is suddenly having a lot of struggle as compared to before, their typical baseline, we usually reach out to the parents and we ask a couple of basic questions. Things like, what has changed? Are you working with anyone new? Have they started any after-school activities or scheduled events that might be impacting them at the school day? It's also really important to consider that type of communication from a behavioral perspective, because if you're implementing something that would potentially suppress one particular target behavior while you're working to replace it, it's very likely that you're going to get that spillover at home. And it's nice for everybody to have a heads up on that, on what to expect in terms of possibilities. So I hope I answered that question, but let me know if there's any follow-up questions to that.
Oh, that was fantastic. Perfect.
Okay. Awesome. All right, so I'm going to go into scheduling for success. And I think a lot of people who work either in a school district or with school districts or with parents, given the circumstances, might laugh at me in terms of scheduling things for success. But there are a couple things that we can do proactively to decide what is optimal for our case management and also for our team overall. So we have to determine the best schedule per team, and that can be really difficult to assess. And it sounds like such a basic thing, but everyone has their naturalistic preferences. So if we're trying to make things low effort and high likelihood, we have a couple things to consider. Things like, what's their preferred mode or modality of communication? Is it email? Is it text? Is it call them and leave them a voicemail on their work line? Is it leave them a voicemail on their home phone? Like all of these things have to be considered when we're determining whether or not we should be scheduling with each individual team member to bring the whole team together. So the other things to consider are things like the needs of each staff member, their schedule within the school district or at home, the needs of the parents or the guardians. So for example, some teachers have preps and their preps are at 1 o'clock sharp every single day and there's no deviating from that. So if you were to ask that teacher to meet at, let's say 10 a.m., because that's the only time the parent can be available, then it ties back to one of those first slides where we have to speak to administration and find a substitute. So there's like a lot of behind the scenes gears moving to make these meetings even happen to begin with, and to happen with the number of members that we have on the team. And sometimes the number of members on a team can be over 10 people. So scheduling, I think, is the hardest thing. And especially if you think about different schedules, especially for outside providers who are working from 3 to 7, let's say, and that's outside of school hours. They might themselves be a teacher, and then they only have prep time available. That's a very common one that I find for like ABA therapists, for example, after school. Time of the school year itself is difficult. You have annual reviews around this time of year, and it can be a lot harder to find any availability for the mental health team because they're running a lot of CSEs. So I think a lot of those different pieces when we're determining the best way to schedule per team is we have to schedule per team, per individual member of that team. And you're going to have to give a lot of reminders. I think typically I send an email out or a text, depending on the group, a week prior. And I say, hey, just checking in. Are we still on for this? Is there anything I need to know prior to the meeting if I were to be the case manager of that team? And in doing that, a lot of times people are like, oh gosh, I totally forgot to tell you. I can't make it that day. It's my son's graduation, or I'm not available that day because I'm getting my vaccine, or I can't make it because I wasn't able to do those observations that you asked me to do because the child was absent. So all these reminders help with the scheduling process, because if any of those things go, you have to follow up if you have to reschedule. Again, people are going to laugh at me because in a school district, rescheduling something that you scheduled a month ago is going to come another month in advance. And that's okay. We just have to try and be as consistent as possible with our scheduling, so that we continue to avoid those pitfalls that we were talking about before. As we move into the in-depth variation of how to create a cohesive team in terms of having a collaborative school model, the pitfalls that I think come with understanding that you're making a team of very different people is understanding that you have to be flexible. And flexibility is hard for our students and for adults, but we have to be mindful that this model will take time to develop and improve, and that's okay. That ties into our flexibility. When we clearly outline the model and refer to the process that's tied to it, it makes it a little more digestible for everybody, and they're more open to having a conversation about the model itself and how to improve upon that model. So I would be curious to see if anybody's had experience before with either a home team or a school team or a multiple service provider based team, in terms of how well they felt team management and execution kind of played out. So let me know, Ray, if there's any other questions so far before I move into the next section here.
Yeah, you may answer this later on, but the one question is, who has the final say when the team can't agree on some particular direction with a learner? I'm hoping it's you, but seriously, so who has the final say? How does that work?
Okay, so the last piece I have here is assign a case manager or a team leader. And I think there's pros and cons of being a case manager or a team leader. And sometimes you have to be that bad guy, to say, sorry, that idea is not going to work here based on the consensus of the team, and move forward with that. And as we move into the later slides, we're going to talk about how we don't necessarily have to be so stringent in terms of dismissing ideas potentially of others, or to help a team move forward if they're stuck. I would say it's very dependent on the type of role that you have. So if you're in a school district, it might be something that you have to escalate up to an administrator and say, hey, these are the ideas that the team brought forth. Please let us know what is the most appropriate given our district and your knowledge base. Sometimes if it's a case manager of a home team, it might be something that information they're more privy to because they're the ones coordinating with the other outside providers and so on and so forth. So if they want to share the type of role they have, I might be able to give them a more specific response, but that's what I would say is that usually the case manager has to be determined. And in terms of determining a case manager, it's usually whomever the primary need of that student would fall on in terms of service. So if it's a student who has a hearing impairment, we would look to the hearing consult as our primary case leader because they have the most knowledge base in terms of how to best help that student. And then we kind of build off of that. If it's a behavior presentation that's most concerning, it's the behavior specialist, and so on and so forth.
That makes sense. That's good.
Okay.
Thank you.
All right. Thank you. All right. So we have our rules for brainstorming. So this is kind of tying and building off that last question about what happens when you just don't agree. And it's part of a process that everybody has to learn, but the benefits that I've found working long-term in any school district is that as you practice this more, people start to do it more naturalistically. And then whenever they go out and make their own team, they embody this model and practice it. So I think the big part of setting up a team is making it a judgment-free zone. Because creative spaces can't have judgment in them. And I think it's really, really hard because our gut instinct is to say that just won't work. we don't have time for that. We have to get this child what they need now. And a lot of it feels very time sensitive, and that adds a lot of pressure to us, I think, as a team when we're supporting someone. But it's important that we kind of like let our ideas flow. We have to foster all those ideas because you never really know when a good one's going to pop up. And sometimes it just takes someone being really brave and stepping out and saying, what if we did something like this? And there have been countless times in a team meeting where everybody feels stuck, and then one random person who's been quiet the whole time, probably sitting on it, waiting to feel out if they're brave enough to share that idea that was like the savior idea. So I think it's really important to keep an open mind and to make sure that we're allowing others to build their own ideas, but also to build off of those ideas. And some of them are going to be pretty wacky. They're going to be pretty left field. I think it's really hard to do that when you're in a position for a very long time, or if you work with the same people over and over and over again, because you all start to just naturalistically mold together, and your viewpoint might mold together, and that is great because it's a sign of a cohesive team. But with that, there's a danger there. That those fun, spontaneous, wacky ideas don't come forth, and it stagnates progress. So when you have a judgment-free zone and you allow all these fun ideas to come up, typically you're able to build off the ideas of others. So going back to that last question, is that sometimes here people respond with the word but, or no, rather than saying things like and, or tell me more about that. Because in doing that, we're allowing it to be a safe space to share ideas without stopping their flow of thought or the other's flow of thought at the table. And that's important because a lot of times if you as the team leader, let's say, or if you're having a team leader respond to you to say, but, or no, chances are the next time you meet, you're less likely to bring up any ideas, let alone wacky ones. And we also want to keep the conversation very fluid. In doing that, you tend to sometimes stray off the topic at hand. So sometimes it's really important for the case manager or the team leader to really help everybody at the table or through the Zoom screen stay focused on their specific topic. I found that when I schedule things with teams, I put the agenda items or the focus of the meeting in the meeting name. So if it's something like FM device or token board or attention cookies in terms of attention maintained behavior, that's directly in the invite or in the notes of the invite so that everybody can at least come in focused, and then you can use that as a tool to redirect back. This is hard when you're trying to stay focused, but you're also encouraging wackadoo ideas. But I think it's important that as the team leader, that anytime someone brings it up, you could say, let me just think for a second and make sure I understand how we're tying that into our focus, and to help wrangle everybody's mindset back. And the way that Ray is probably going to laugh when I talk about this, but I am like a flow chart human being. We always have the big whiteboards. We use Post-it notes. We use the annotation device in Zooms, smart boards in schools, the whiteboard feature on a smart board, notepads, anything that can concretely show what it is that you guys are talking about. And a lot of times these end up looking like webs. So you start with the focus item and all these ideas start springing out and you say, oh, I can see how that's related, and I can see how that's related here. And while that might not seem valuable because you're just throwing ideas on the board, it actually visualizes the cohesive wants of your team. So it opens for more conversation with a cohesive model in that, like, let's say in the middle we have FM device. So we have our hearing consult, we have our hearing consult provider, we have an OT because the student has fine motor controls and they're having a really hard time independently putting in their hearing aids. And then we have a behavior issue that the student will knock their chair over if they get frustrated during learning because they can't hear the teacher properly. And all of a sudden you start seeing all these lines connecting the dots. And how important it is that all of those things matter. All of those things matter for that child to be successful, period. And not just in isolation, but how they're connected with one another. So it's helpful to have the visual, not just for the sake of staying on task in terms of on topic, but also to visualize how all these services and all of these providers are going to have to work together. And in doing things like this, I found that this helps with scheduling. So if you find that there's a lot of overlap with two particular areas, those two service providers should be the ones in contact the most. So you might have like one team leader who checks in on those two people who are regular communicating, and then it kind of creates this like call tree of sorts where you can kind of update people as needed. And it's important too when you're talking about measurement of goals or progress marks and things like that within the school district, but also for home targets in terms of their rate of acquisition and things like that, that all those pieces tie together. And our last one here is the quantity. So I am famous at school for saying quality over quantity in terms of our expectations and things that we reinforce at school. But this is a total flip of that in terms of getting our teams cohesive and allowing for that brainstorming to happen, is that we just have to brain dump as many wackadoo, awesome left field ideas as we can. And then we rein it in from there after using our visuals and having all of the service providers give their input. So I'm going to pause here because that was a lot. And I just want to see if any other questions or comments came up from that, Ray. So let me know.
So what I'm wondering is,
yeah,
for the behavior analysts that are watching, how do you navigate the waters of explanations of behavior based on a child's emotions and people thinking about what the child is going to be thinking about and feeling, etc.? So how do you address that?
I think it's finding a happy middle ground, but also understanding their perspective of it. So if you have a psychologist coming to the table, they are going to have a different explanation than you would. Same with an occupational therapist or anyone else. They're coming from it probably a little more with common vernacular than we would. And it goes back to some of those earlier slides where I find that BCBAs or BCABAs tend to use language in a way that isn't always receptive to others when you're talking about feelings. So when you try and say like their feelings don't matter or something very curtly like that, you've already lost your audience. So I think part of it is allowing all that fluid thought and brain dumping. And then you say, okay, that's great. Let's focus on what's observable right now from this student and how can we modify that to be more successful for them. Because regardless of them saying they were angry and frustrated, so they threw their chair down, we could say, okay, well, let's talk about what happened right before that you perceive the frustration might have happened from. But in doing that, you're actually talking more about your antecedent behavior and consequence flow, and you can kind of rein it back in from there. I would also say that it's hard when you're teaching that up in terms of note-taking or data collection from people, because a lot of times they will write things like that, like they were ticked off, or if the child was crying, they were sad. And when you talk to the student afterwards, they're like, I was just really excited and happy and I cried. And sometimes it's helpful to bring those service members to those conversations or let them know in terms of what was actually perceived by that individual too, to normalize that everybody expresses things differently. But the use of that type of language is usually explained in terms of data collection. So I found that to be really helpful to say concretely. I would prefer it if you just describe as if I couldn't see what was happening in as much detail as you can, without putting your own assumptions on how that person is feeling. Because then this way we get as much information about that and we just don't write a plain note saying they were sad. So expecting a lot of your team in terms of what they're reporting to you is also part of that. And I think that's facilitated through the rules of brainstorming, is that they should feel open to just fluidly write and share. And then when you come together, you can fine tune that a little bit, and give them feedback, because all staff training requires that. And that goes into the collaborative model, is that you're putting in a where you're modeling and providing feedback within your training of just building a team. And that applies to, as they go forth and interact with that student, collect information on that student, and then bring that information back to the team.
Got it. That makes sense. So one other question would be, so in my dealings with teams in schools, now granted, I'm not part of the team in the school, but I know that it's helped me to have a thorough and working knowledge of the DSM-5 definitions of the disorders that we're talking about with the psychologist, the occupational therapist, et cetera, especially the social worker, because that's what they're referencing when they're specifically talking about a child's diagnosis or diagnoses, correct? So is that something that you do? And is that something that you would recommend other behavior analysts do? Because as behavior analysts, we really don't receive that kind of training. We have to take it upon ourselves to, really delve into the DSM and memorize what we have to memorize so we can be more effective during those meetings. Does that make sense to you?
It does. And I hear exactly what you're saying. And I would say that doing your own independent research to be best within the role that you have. So if part of your responsibilities is talking about children who have diagnoses, yeah, we should understand the diagnoses and kind of the caveats that go with those. But it's also part of the whole being part of a team thing, in that I've learned a tremendous amount from people, just talking to them and being an active listener. Ask questions if you don't know. It ties back into some of the earlier slides saying, hey, if I explain this back to you, can you make sure that I didn't miss anything? So I'll do that on the reversal. Instead of asking someone to explain something I just said back to them, I would ask them for clarification. So it's my understanding that this child has ADHD. And with that, these are the traits that we're feeling are most impactful in terms of their school presentation. Would you agree? Because this way, at least they have the opportunity to explain it back if it's wrong. And if it's something you're not familiar with, we should have a clarification for that. And I think more often than not, a lot more people at the table are probably like just as lost as you might be in terms of what certain providers are saying. So that's why it's really hard when you have so many different people from expertise backgrounds that are not naturally cohesive. And then they use a lot of technical language, and a lot of people, especially parents, are sitting at the table thinking about like the language that's being used, and a lot of them they don't understand. So this tends to lead to a lot of those gears getting stuck, either in a CSE meeting or in a team meeting or in a private just team meeting without the parents present. Because when you have that, you can't have a productive conversation if everybody isn't on the same page in terms of their knowledge base of the material and the language that everybody's using. And I find, again, this visual piece really helps with that too. So sometimes people, I'm thinking back to like an example that just happened last week where someone brought up a terminology and an occupational therapist was like, I don't know what you're talking about. I don't know what that means. And so they explained it to them, and then they drew a picture of what that represented to them, and they added it to their Post-it note part of the web that we were making. And it was great because one person used words, the other person responded in a picture, and like everybody still understood. And collectively, it got us to where we needed to be. But had they not paused to ask for that clarification and tried to work off of the same material in terms of vernacular and knowledge base, that wouldn't have come, and then we would have been turning our gears a bunch for an excessive amount of time. So yes, I hope that answers that question.
No, that was great. Thanks, Sarah.
You're welcome. All right, so any other questions or comments so far before I move forward?
There are a couple, but I think we're going to save them for the end.
Okay, all right, so I'm going to move forward a little bit. So this is where we're getting to the true model of building a collaborative team. So this is Tuckerman, and this is Kumar, Deshmo, and Adhish from 2014 and 1965. So Tuckman originated this in 1965 in terms of its concept. Some of it is known as storm norm, but it's the basic agile model of team building. So when we talk about this, we're talking about all these different teams over here that originate off of one need. So in our case, it's the students' needs or our assigned case member needs. And then we have all these prongs of different people that can come from that. So we have to think about all the different referrals that come with that in terms of service providers. And then all of those people have to bring their knowledge base, and then they have to work together and bring all this information and start zigzagging across. And then we build these cohesive teams that sometimes look like tiered trees. And that kind of goes back to what I was saying before about maybe there are two people that really are going to be the primary team, and then it filtrates out to smaller subsets of teams within the school or outside the school that tie everybody together. So we're going to talk about this model. So when we first form a team, people tend to not know where to start. They're trying to figure out the kids' needs. What are we looking at? Who does the service provider have to be in terms of their purpose, fulfilling that purpose as a staff member? And then also everyone is going to be looking for guidance and direction from somebody. It might not be necessarily immediately assigned, but in the forming, you usually get like the happy, best behavior version of everyone. So if you have like a home provider and the school psychologist and mommy and daddy and whatever the makeup of the team is, everybody's very polite. Everyone's on their best behavior, and they're looking at like random tasks that they might have been assigned or assumed would be their responsibility coming into the team themselves. So it's kind of understood that teams are put together for whatever various reason. We have lots of different personalities. And then they're just expected to like magically do this work and create progress towards a goal for someone else, which is kind of like an abstract idea. But in this model, it is expected that you're going to have storming. So storming ties back to our previous slides where we're expecting conflict. It's never perfect, and it's going to be ongoing, and there's going to be things that pop up, interpersonal issues that pop up, scheduling issues that pop up. Lots of power struggles come up here. But this is where it's really important that we develop whoever the facilitator would be or the team leader, because then we get into coaching and we can help diffuse those power struggles. Norming is our next step. And this is where everybody's like, all right, I got it. I know my role. I know my responsibility. I know my schedule. I know who the team leader is. We're starting to come together. We're starting to respect each other's strengths and backgrounds and what expertise they bring in. And a lot of this comes from the storming session. So without the storming session to happen, you don't hear everybody's level of expertise and you don't hear their perspective. So it's really hard to jump from forming to norming. It's like basically impossible. But in doing that, you're going to see that new tasks and new responsibilities will come up. And a lot of times, if you're in an established team, this is where you end back up again as the school year progresses. So it's definitely like an ebb and flow of where you are in this sequence of events. Once norming happens and everybody's like on it and they get it and they are doing their responsibilities on their own out in the world, you start to see performance. So there's clear vision and purpose, a focus on goal achievement, not just for the student, but for themselves as providers. So they want to feel successful in what has been delegated to them. So a lot of this ties back to the case manager is that, okay, we came together, we did our whole visualization and storming together, we worked it out, we all came to an agreement. And if we didn't come to an agreement, our facilitator helped out with that a little bit. And then that facilitator then delegated tasks to us, which we should, in theory, based on the delegator, be successful in executing. So the performing piece is really important because as a team leader, you'll start to see who is following through with their assigned responsibilities, so that problems are prevented and solutions can pop up based on each individual team member's performance. And sometimes this brings us back to storming because other team members might become upset. So let's say team member A did everything they were supposed to do. And man, they organized it. They have like colored tabs, looks gorgeous. And then team member B did everything that they were supposed to do. Great. Team member C said, oh, right, I forgot about that. So this is where the performance piece balances with our storming and balances with our need to normalize that and our norming stage for the facilitator. Our last little bit here is adjourning, where we feel the reinforcement of completing our task and hopefully good feelings of achievement. We have recognition here. I think part of the case manager, facilitator, team leaders piece is making sure that acknowledgement occurs for each individual staff member, and you'll start to learn everybody's preferred way of acknowledgement. But it's something also that, like, once this piece happens, we tend to cycle back where we're never really in adjourning for a long time. But it's something that can be possible for teams that work really intensively with each other. So I found that at this point, having worked in my school district for several years with a lot of the same team members, we are able to jump most times from forming a new team, who needs to be on the team, who's here. All right, we already kind of know where we're at. We do our storm session, we normalize it pretty quickly, and then we're on it, and we're just fulfilling our roles and then achieving those. And if they don't, more often than not, the case manager can help them bring it back in, or catch them up at least bring it back to the team to explain why that happened, and then support them to get back on track. So I'm going to pause for a second. I'm going to give a code word and also give everybody a chance to kind of throw in questions or comments here. But the next code word is trampoline. So the next code word is trampoline.
Okay. So there's two questions. One is you're going to have to be as careful as possible answering. And the other one, you don't have to be so careful. So, all right. So the first question is, so how do you guys handle non-compliant staff? Once the team comes up with a plan, I mean, Yeah, I mean, there's always going to be someone that wasn't in on that meeting that disagrees, has other thoughts, or they say that they're going to do it and then they just don't.
Mhm.
So how does that get handled?
So I think if we relate it back to this model, it sounds like that person is stuck in the storming piece of this model, and that's okay. Some team members will take longer and will need more support. And I know like a lot of times we have a lot of timelines that we have to consider, but each individual person might need more support in terms of getting to a consensus. If you have a team member who's just not a good fit for the team or has been stuck in storming, or if it's something that is like a gross overreaction to things that are happening here, either we provide that staff member with more professional development or individual staff training, or we escalate it up to like an administrator or a team supervisor, an agency supervisor, and have a conversation with all three of those persons, just to help it along. So that's the answer to the first question. Can you repeat the second question for me?
Yeah, so the second question I'm looking at is probably in the forming and storming phases, because there's always either a member of the team or somebody outside the team, or maybe even an administrator that suggests that a non-empirically proven or non-evidence-based treatment protocol procedure is probably the way to go. And so how do you guys work through that?
So I think the hardest part here is that you kind of have to establish either the agency or the school district as a data-driven institution, and making it very clear, like, I hear what you're saying. As a parent, you're more than welcome to explore those on your own time. However, we found that that's not empirically supported, and therefore it's not practiced here. So it's kind of one of those things where we're setting boundaries when we're formulating our teams and understanding each role and responsibility of a person. So we've had situations where they want a BCBA that's a home provider to do extensive feeding descents programs, and they have no experience there. And it's kind of like, well, they have to work within their realm of expertise, their scope of practice. And we have to have those hard conversations, but typically once we explain the why and not necessarily the why nots, that it's helpful. And then offering alternatives is also really helpful, and explaining here is the data to show that. You're always going to have people that are like, well, I still don't care and I want it this way. And that's why a lot of times either a higher up person, either an administrator, is helpful in these situations in terms of navigating certain team members, or you get into a place where you're going to be stuck in the storming piece until someone either is able to expand their viewpoint, or be open to practicing something else for the interim. So sometimes it's offering an alternative. Well, let's give this a try for 3 weeks, and then we'll come back together and see how it goes, to offer your empirically supported pieces to show impact. And we've had a lot of situations where parents are like, I'm not going to ask you to do that. Then I'm going to pay someone cash or whatever on a Sunday to do those things. And that can be hard because you're still never really truly in agreement, but at least you've been able to move beyond that and do what you need to do in your role within this model.
Right, that makes sense. Yeah, that's almost always comes up at some point. But okay. So more a comment than a question.
Sure.
Adjourning doesn't rhyme with any of the other words. So with that said, I'll let you continue.
You know, I'll share that that did bother me initially. So I'm with you. All right, so we're going to go to the next one. So now all of that's all well and good, right? But how do we achieve that norming stage, and how do we get everybody to like work together so beautifully and magically? And here are some daily strategies to practice that are pretty effective. So these two kind of go together. So we have micro acknowledgement and behavior specific praise. Mary, I really love how you took the initiative and called that parent right away. That really saved our team a lot of time in terms of having to fix that later on. Even if it's like someone who was struggling, just showing up for the meetings and be like, wow, I really appreciate that you made the effort to be here today. Your presence is really needed and we appreciate you being here. Those types of things all the time not only pair yourself well with others, but it really helps those who are on the team understand what you're expecting of them in a positive way. So it's kind of one of those catch them being good situations, but it really is helpful in terms of keeping things positive and making sure that we're not staying in like that but or no stage rather than the and or tell me more stage. Micro professional development, this kind of ties into the question before that you mentioned, Ray, about, well, what if they're just not on board? What if they just don't get it? What if they're really aversively reluctant? And sometimes micro professional development helps. I've seen this done across many different environments and different ways. So some examples could be just having the school psychologist meet with someone for 10 minutes to describe the DSM-5. Or it might be someone from an outside team talking to the person on the inside team about scheduling. So it could just be something really simplistic, but that has to be said for everybody to understand what the realistic expectations within each setting and area of expertise is, so that you can be most productive. Utilizing different modalities regarding communication. So depending on your individual responsibility and roles, it can be really hard to communicate with anybody, period. So for example, I'm in 3 different elementary schools on any given day of the week. So if I need to talk to someone in school A versus school C and I'm in school B, it makes it really hard to find those people if I just wanted to like run down the hallway and pop in. And what I've seen is it's most easy in a school district to just kind of walk around and walk down the hall and pop into the teacher and say, hey, I spoke to mom. I just wanted to let you know really quick, here's what we talked about. And then there are other things that you might just not be comfortable writing in an email, or it might not be appropriate to put in an email or a text. And that can really hinder team cohesion because the communication either gets stalled until you can all come together to talk about it, or it gets shared in a way that like doesn't make sense or is not appropriate. So we have to figure out the modalities that everybody's comfy with in terms of communication, and then go from there in order to build your most cohesive model among team members. So in terms of professional development, you can always ask for your own professional development, and I would encourage you to do so with all the other service providers, because I can only speak personally to this, where listening to other people speak about their scope of practice and sopping in all of their expertise makes me a better practitioner overall, and it makes me a better team player and a case manager, because I can really pick up on their code words and the vernacular that they're using, and then I can help them translate to someone else, like a parent, let's say, or an outside provider. And it's important that you build that into your schedule. And I think a lot of people feel overwhelmed with the idea of professional development, especially in a school district, because everything's so tight for time at certain times of the year. But even if you're looking for a 5 to 10 minute chat, and I think Zoom has really allowed a lot more of that to happen, and that's been really a cool sidebar conversation there. But this really helps because it will develop your overall process in terms of developing a cohesive model, and then you selectively and systematically improve upon that over time. Okay, so this is where I find a lot of like interpersonal things where the subject matter expert respect has to happen. If someone is coming in as a speech pathologist, and you might have worked with other speech pathologists before, and they're recommending something that to you is like super left field based on everything that you've heard from other people, that goes back to our rules of brainstorming. Let the wackadoo ideas fly, and then feed it off of each other and see how it goes. It's okay to ask questions. It's okay to pair it back for understanding. It's okay to check in for understanding. And all of those things should be really included. Do we have a question, Ray? I saw a notification.
Yes, but we're going to save it for the end.
Okay, all right. So we're going to establish standards of practice, and we are going to delegate a responsibility to each appropriate team member. So this kind of goes back into that tiered piece of our individual teams. So sometimes we might delegate 2 people within the team to really work closely and cohesively together, and then report out to everyone else. And as needed, we bring the whole team together. This is, I think, the trickiest part, is like when you learn to accordion this really effectively. It can be very beneficial, but it can also be exhaustive as the case manager. But if you use the scheduling and the reminders and all those other pieces, relying on those that are assigned their roles and allow that delegation to happen, it could be really fruitful. The other piece is gathering information and replenish your vocabulary, because that shared vocabulary is so valuable. Because who doesn't love effective communication? I know I do. And when I feel like I'm really in a true back and forth banter with someone, it's really comfortable. And when you move past that storming stage, a lot of this starts to happen. And it's so great to see, especially over time, when people learn what's reinforcing to another person, what's aversive to another person in terms of their learning, but also how you approach the way that you're talking about things with each other. And that gets built over time. And everybody has their own sensitivities with language just in general. And they can get really defensive when it comes to them being the subject matter expert of something. So I'm going to talk very briefly about some of the examples that I use in my school district. So I'm in 3 different schools. We have a 6-day schedule, not a Monday through Friday. We have a day 1 through 6 schedule. And I block out times where I know specific teachers have their preps. So the first day of school, I want to know everybody's preps. And I send this out and I say, these are the times that I am not available because I am assisting my teams. And I make it very clear as a case manager that this is my expectation for my teams, but also for everybody else. And it's setting up a boundary and a level of respect for those teams to say, like, let's say day 3, I'm available from 9:35 all the way to 12:50, but don't bother me first in the morning or late in the afternoon, because those are reserved times for my teams. And that is really important in terms of scheduling, because a lot of times it might become day 3 and the person's absent. And you're like, okay, so we're going to move to the next day 3, but it's already on the calendar. So it's this like rotation of consults. So if you do have to skip a day or a week, you're covered already because it's built into your schedule. I'm going to do the last code word, which is butterfly. The last code word is butterfly. And then I can pause here because this is just something for you guys to have. So these are all linked here as examples of ways for people to reach out to us as team members for support that will help eventually form your team. So this is kind of a cheat sheet, referral sheet that one of the psychologists in my school district actually made. Hooray to Maria Petrolakis. She actually just passed her BCBA exam, so go her. And she made this where everybody fills out this form, you make a mini team, and then you build from there in terms of tracking goals. So this flow chart is really great, and I wanted to share that with you all. This is a digital intake form for any sort of support, so you can modify it. It's something that you can copy and make it your own and change whatever you need to change. And then I added a referral letter response examples that help with responding to teams. So sometimes you have to say no, but say no politely. And sometimes you have to say yes, or sometimes you have to clarify some rules and regulations to make sure that everybody is cohesive with that. And Sarah Taylor was someone that had shared this digital form with me, and she gave me permission to share it here too. So this will be embedded. So I'm going to leave it to questions.
Great. So there are a few, but they kind of break down into these two questions. One is, how long has this team been in place in the Merrick School District? And then the second one is, how do you even get it started? Like, someone who isn't doing this in their school district and wants to, like, who do they go to? So those are the two, really like the two questions that summarize all of the remaining questions.
All the remaining questions. So they are great questions. I will share how I did it in my district and how I've heard of other people, because I've kind of built off of the ideas of others in terms of brainstorming. One is having more conversations like this. Because I feel like this isn't really talked about, but it's a major part of our progress as professionals, but also for our learners. And I think to get it started, for me personally, in the current district I'm in, I was a new person. It was a new role that no one was familiar with, and I really could have been met with a lot of resistance. And at moments I had been, but it's been a few years that's developed. But every month, sometimes I have a new team of people that I've never worked with. So a lot of the school district teams can just pop up, teachers that you've never worked with before, other providers you haven't worked with before, especially if you're in a larger school district. But also every month I have different outside providers join the team. So it could be a supervisor or a parent trainer. It could be a neurologist, an ophthalmologist, you name it. So the teams themselves are not nearly as established as you would think in a steady position in a school district. But there are some key players that tend to stay, like the school psychologist, the social workers, certain teachers if they're in some of our more restrictive environments. So those are things to consider in terms of key players, I would guess, trying to answer that question for those that are looking to get started. And I think presenting this as a concept can be hard. So I remember when I first started, I had to kind of explain how I wanted my year to look. And thankfully they were flexible in that. I did have to do some persuading and evolving myself over the years. The way that I had made my, the Tuckman model initially did not remain the same over the few years that I've been there. So I've had to be flexible in my own model building to make it fit the district I was in. So I think big picture is knowing that you want to change, and that change you hope is a positive change, setting specific goals and then tracking those goals. So my first year, I took data on my staff meetings. I took data on rate of acquisitions of our students, and then I kind of compared them. So I said, oh, wow, these people canceled a bunch, and that student made a lot less progress compared to this other group of students. And I was able to present that to administration and say, wow, these things impact the student, the TA fade process, other things. So data is always your friend. And that has helped me along the way, and it has helped me get providers on board. Because another part of the shared information is sharing data. So depending on that, and this could be like a whole nother workshop, but in terms of how you share your data, digitally, paper, however, having them see graphed progress of a learner because of the input that they have has been very reinforcing for our staff. And it makes them want to learn more and be even more of a team player. So I find that that's been really helpful, is not only being part of the team development, but then when you bring back to the adjourning piece and you celebrate everything, having that data to concretely celebrate a student reaching a goal or an increase in rate of acquisition or something like that, that can be really beneficial to establishing something that wasn't there before. And also considering the effort of putting this in place. So sometimes we just start small. So I know I personally started with just our most restrictive classrooms. And that was a really minimal amount of students and teacher interaction and team players. And then I built it slowly over in time to include more different types of service providers as we kind of got into a groove. So I hope that answers those two questions.
That's a fantastic answer. Thank you so much, Sarah. This has been an amazing, unique, informative workshop, and I'm sure that that everyone who's watching truly appreciates all of your time and expertise.
I hope so. They're always welcome to reach out to me if they have more questions. I believe I have my email up there, but if not, we can provide it, and a copy of the PowerPoint if needed for the links.
That sounds great. Thank you very much, Dr. Sarah Heller.
You're welcome. Thank you, everyone.